Looking at antisocial behaviour, AIC recently published a study looking at the causes of antisocial behaviour by McGee and colleagues. Looked at a range of factors, and what they found was the strongest predictors of a kid engaging in antisocial behaviour: disruptions in parenting processes, so poor parenting, issues that were affecting parenting, including maltreatment, drug and alcohol abuse issues, poor school performance and early childhood aggression. And they made suggestions that programs were needed to enhance parenting practices, including improving communication between parents and kids, better supervision of kids and monitoring of kids, that these were important issues. And we've heard this in the last day. This is not stuff that should be something new for you if you've experienced the previous day's presentations. It's also important to realise it's not just about the environment, about how you live. There's also a genetic factor which is becoming more evident. Capsey et al. Studied a birth cohort of 1,000 children in Dunedin, in the famous Dunedin study in New Zealand, and found that among maltreated male children, those with a particular genotype, the MAOA genotype, which means nothing to me, but I'm sure it's important, were more likely, though, than those without the genotype to offend later in life. So basically what it meant was if the gene was switched on and you had a really traumatic experience and no sort of intervention to address those issues, you're more likely to offend later in life. This is a pretty important finding. And there's now work being done by James Garbarino in the States, Ray Corrado in Canada, focusing on this idea of intervening much more with when you identify kids who have this gene switched on, who are traumatised, getting in early to avoid them heading into a pathway which will see them committing a series of offences over time that may get more and more severe. And Garbarino talks about the guys on death row that he visits and talks to, interviews, the sad, scared little boys who are also very angry, and very large males who've committed serious, heinous crimes, and the impact that they could have had if they actually intervened early with some of these guys. So let's set the scene around the child maltreatment element. Let's talk a bit about substance abuse. Now, the demon rum theory, the explanation for violence and abuse in the home caused by alcohol abuse, it's one of the most popular, pervasive theories that's been around for years. And there's plenty of research to support it. Research investigating homicides, assaults, child maltreatment and domestic violence all produce substantial association between alcohol or illicit drug abuse in the family and violence. We also know that the variables that you find associated with both the presence of substance abuse and or child maltreatment are pretty similar in families. Parental inconsistency, poor limit setting, excessively harsh disciplinary practices, parental conflict or domestic violence, poor communication, parental absence or unavailability, a family that's mobile, that moves around a lot, that's socially isolated, and where a child is often described as hyperactive or difficult. These things don't set the child up well for setting up their boundaries of appropriate behaviour, setting up the consequences of behaviour, and obviously for supervising or shaping their behaviour. And there's a biological effect also. We now know that children can be exposed in utero to alcohol and other drugs. If mum's taking drugs, mum's drinking alcohol, especially if she's binging, this has a serious impact on the fetus. It can make children when they're born more susceptible to alcohol and other drug use later in life. This in turn increases their risk of coming into contact with the criminal justice system. Now, perhaps the biggest issue we're dealing with at the moment, becoming the most significant, is fetal alcohol spectrum disorder, which is a term used to describe the range of disabilities and the continuum of effects that may arise when alcohol passes over the placenta from the mum to the baby during pregnancy. We know that children with FASD display a range of characteristics which are likely to result in their being overrepresented in the criminal justice system. Attention deficits, memory deficits, hyperactivity, difficulty with abstract concepts, an inability to manage money, poor problem-solving skills, difficulty learning from consequences, immature social behaviour, being inappropriately friendly to strangers, a lack of control over emotions, poor impulse control and poor judgment. And again, from the comments we heard yesterday about children and young people and the maturity of people as they get older, having these sorts of issues to deal with isn't going to help your ability to maintain, if you like, good decision making when it comes to taking risks. We also know that children who are affected in utero, who have FASD, we're going to require more care when they're born. This is going to lead to more family stress, less coping perhaps by the parents. The parent herself and himself as well may not have the skills or the capacity to parent, bearing in mind they may actually be drug affected or alcohol affected. And there's potentially a higher risk of abuse and neglect therefore, so it's like a vicious cycle. We also know there's an actual environmental intergenerational transmission effect around alcohol and drugs, a social learning effect if you like. If you're growing up in an environment which sees alcohol, using grog, drugs as appropriate, as a normal behaviour, you're more likely to adopt that yourself when you get older. We also have the extreme case where some parents will actually push children into using substances at an early age. There's a horrendous case which has just been resolved in the courts in Tasmania where a mother and her partner prostituted a 12-year-old girl. They hooked her on alcohol and I think drugs as well. And the benefit of that, I guess, for them would have been, one, she would have been more easy to control when they pushed her into this behaviour. Secondly, it might have numbed her from some of the trauma she was experiencing. And thirdly, as she was hooked, it gave to some extent a motivation for her to continue to, if you like, be pushed into these offences, into this exploitation, because of course they wanted money to keep feeding the habits. Horrendous situation, extreme, you won't find that very often, thankfully, but this is the sort of stuff that can happen with our kids. We also know that children and young people will use alcohol and other drugs as a coping mechanism to cope with experiences of abuse, adverse childhood experiences, and if they're actually feeling environmental stress from a range of causes, they can again turn to alcohol and other drugs as a way of coping with that, as a self-medication. So what's all this mean? Okay, well I think the conclusions are the following. Firstly, some young people are naturally resilient. Now, most young people are going to grow out of any risk-taking behaviour and off they go into the wide world beyond having a positive life. Of those who have experienced, if you like, more traumatic experiences in their early years, there are still some who are going to be naturally resilient and will go on, have good positive lives and will get over their experiences. Others are going to need assistance. At key points in particular, that we're going to need to provide assistance to address issues of trauma and to prevent antisocial behaviour. As I mentioned before, this may be especially so in cases where there's actually a genetic predisposition, if you like, to violence, to offending, which is caused, if you like, by or triggered by the negative environmental impacts. We need to intervene very strongly early on to try and address some of these issues. As the Minister also indicated, I think quite clearly, there's lots of programs out there now which are trying to divert young people who have committed offences from re-entering the criminal justice system. I haven't got time to go into those, but there's a range of programs across the country which are doing a great job. Some could argue we need to have more resources put into that area, but I think certainly the programs are there. It's important we actually get these kids to prevent recurrence of antisocial behaviour, to prevent recurrence of crime. There's a therapeutic intervention or a therapeutic approach taken, not just incarceration or a restorative justice approach when we look at juvenile justice. There's an opportunity to get in there and actually address some of these underlying factors, and we need to try and take the most opportunity we can to divert kids and to get them onto a healthier, happier pathway. And this may require us changing sentencing practices to look at longer periods of supervision and less time in custody, or essentially ways that we can actually ensure kids go into therapeutic programs more readily. The next couple of bits I've been talking about 15 years, and I'm sorry to say that there's still need to say it, even though we've improved a lot. Alcohol and other drug services. If you're dealing with an individual adult who happens to be a parent, the service has to look at the family issues as a whole, the parenting issues, the child's issues. You can't just treat the individual, even though that can be difficult at times. There's now improved training being provided around children's issues for alcohol and drug workers, which is a great step. The National Centre for Addiction Training, National Centre for Education Training on Addictions is doing some work on some new vet courses in this area. We need to have more youth-centred services for those young people who are engaging inappropriately in alcohol and drug abuse. We also need to have an enhanced engagement with the child protection family support sector and vice versa. These things are fairly closely meshed, as I think I've demonstrated. Maltreatment. This stuff has been said to death by thousands of people over the last 20 years, but I'm going to say it briefly again. Prevention is better than cure. The evidence is there. Home visiting programs for the new mums and new bubs conducted by nurses has a significant impact on child health and well-being, and parental well-being as well. The need for early intervention, intervening early when the child's still in utero, intervening in the early years, intervening at key transitions across the life course, especially at adolescence. These are all important areas where there's good research that shows we can get in there and have some really significant gains at relatively cheap cost. Certainly the costs are outweighed by the actual benefits we achieve. The need for parenting programs. There's some great parenting programs out there with some good research, such as Triple P. We need to support not just those parents who are already doing the job, if you like, who are already established. We need to support youth who are going to become next generation of parents, the soon-to-be parents. And of course, we need to support young women and the newly pregnant to actually encourage them not to be engaging in substance abuse, not to be engaging in risky behaviour, and therefore to give their fetus and themselves the best chance possible. Role of community. We heard a lot yesterday about the messages that young people are getting bombarded with around alcohol, for example, and that sort of behaviour. There's issues around desensitisation to violence that's been talked about quite a lot in our community over the last 10 years, which I would tend to see as a problem. If we don't like these things, the community has to step up and actually set some clear behavioural parameters on what's appropriate and what isn't, and what are the sanctions if you actually transgress those. Parents can do this, they're certainly part of the solution, but the education system is also ideally placed with the new citizenship and ethics classes in the national curriculum. I think there's a place for education system to step up and provide things like problem solving and decision making skills for young people, identification of consequences of actions and how you go about that process of thinking through the options, and also communication and assertiveness skills, so when young people are faced with risks, they make some better choices. It's also about engaging young people in part of this process and being part of the solution. I think young people, when they're given a chance, can do amazing things. And also, we're going to say you can't do certain things. You can't go hooning, you can't use drugs, you can't binge drink, etc., or be violent. We've got to give a range of options for appropriate risk-taking, and Kieran Walsh yesterday gave some great examples of programs across the country which give kids the opportunity to do adventurous type things and sort of test themselves. These things are also important. Okay, to finish off, what are the barriers and why haven't we achieved all this already? Well, there's been a lot of good progress, but the reality is policy making is different to evidence-based policy. Policy making takes into account a whole range of factors that impact on the community and on government, and the evidence is only one aspect of that. And for whatever reason, we haven't managed to convince governments to make that significant investment sometimes that's needed to actually move forward. So there's also an ongoing failure to invest in longer term projects to give things a start and really let them establish themselves before we pull the plug. We've got a strong focus on putting out the fires, media-fuelled inquiries, key cases that have gone wrong in both juvenile justice areas, child abuse areas, drug and alcohol abuse areas, out-of-home care areas, means that we're focused on the crisis response, getting a response to this particular issue, and sometimes we lose focus on the prevention stuff which is more effective in actually driving that. I guess lastly I'd say that despite competing roles and issues, despite siloed funding streams across the different professions, health, police, welfare, etc., we have to get together in a concerted sense to actually cross-sectorally support a prevention approach. Kieran Walsh said yesterday, police can't do it alone when dealing with juvenile crime issues. I agree with him 100%. But what we need to do is get all the sectors in the room and say we all think prevention's right, we can all take a role with this, but let's push for the prevention investment we need. So to finish where I began, most kids will grow out of risk-taking behaviour. Most will try a few things. Some will actually engage in antisocial behaviour and some will engage in crime, but most will move on. Some kids, especially those from traumatic backgrounds, will need assistance to move forward positively, however, and we've got to be prepared to provide that support. Prevention's socially and economically cheaper, produces better outcomes long term, and it's up to us to fight for those supports. Thank you.